Hello there. My name's Dr. Michelle. Lovely to meet you. I believe we haven't met before, have we? Are you new to the area? Oh, well, welcome. Thank you so much for choosing our optometrists. How can I help you? Right, I see. So you're overdue for a full comprehensive examination. That's fine. Oh, okay. So you've got something in your eye, which eye? Your right eye. Okay, well, I can take a look at that. When did you notice that there was an issue? Oh, okay, so it's been a couple of days. Does it feel really itchy, scratchy? More of a scratching. Can you pinpoint maybe where this might have happened, or it might have come from? Do you work on any sort of building sites with rubble? No. Could it be you've maybe fallen over, gotten some gravel in there? No. Sometimes it can be if things have splashed back when you've been cooking. You're not sure? Okay, that's alright. I can have a look and see if we can get that cleaned for you. We've got some great solutions that we can pop in eyes, and I can give it a nice wipe just to help clear out that area. Okay, but we're going to be performing a full comprehensive eye exam anyway. It's probably best we try to remove what's in your eye first before we continue, just so that the irritation isn't maybe affecting your results at all. Does that sound okay? Alright, you take a little rest, I'll just prep. Just pop some gloves on so that I can keep the eye area nice and clean. We don't want to pop anything else in there at all, do we? And otherwise, do you feel like your eyesight's been fine? Nothing that's really bothered you? Do you wear glasses? Okay. Have you ever been advised to wear glasses? Do we have on file your most recent examination? We don't have your results. Can you remember at all what your results were? So you had a low-grade prescription. Okay, could you give us the details at the end of your session? We'll go down to the desk, we'll pop them in, and we can try and see if we can find a record from your previous optometrist. Is that alright? Great. Okay. Let me just have a little surface look at the eye first. Okay, stay still. I'm just going to peel it open here. Okay. Alright, look up for me. Look down. Okay, look right. And look left. Where is it about so you can feel? In a corner. Okay. Stay nice and still. Okay. Look right for me again. Okay. I can't actually see anything. If anything, that's a good thing. If we were to see something, it might end up being concerning, might have damaged the actual iris itself, but I don't actually see any grit. Now, that doesn't mean that there's nothing there. There could be something in the back of the eye. We do have an x-ray, so we can look at the back of your eye and see if there is anything lurking back there. But otherwise, what I can do for you is I can pop the solution in, we can clean it nicely and just see if that makes a difference. Sometimes it can be like a build-up on the eyelashes, or maybe an eyelash itself sort of poking and irritating. You could potentially have a sty developing in that corner. That can sometimes feel like a hot sort of stabby pain. I think it's more likely. I don't see, excuse me again, I don't see a sty developing, but sometimes it can be on the back side of the skin and we might not see it for a few days. So I think that that's probably what's most likely. What I'll do is I'll clean it for you anyway, and I'll also provide you with some sty drops just to try and help that. But the best thing for a sty is usually a hot compress, and that should help it go down. Alright? Yeah, just keeping that eye nice and clean. You don't wear any excessive eye makeup or lashes. You don't get lash extensions. You've had them recently. See, now lash extensions are perfectly safe for the eye, no problems at all, as long as they're applied correctly. If they're applied incorrectly, they can cause an irritation. Also, being mindful and making sure that your lash technician's tools are nice and clean and sterilised before they're used on you. So making sure that she's sterilising them after every appointment. So just be mindful of that next time that you have an appointment. I can see that you've had them removed anyway, so okay, right, I'll grab the drops now. Right, put those to a side for a second. So here is our little solution here. I'm just going to do a couple of drops into your eye, okay? So if you could just keep your eye nice and wide for me, I'll be as quick as I can. There you go. Alright. Feel free to just close that eye for a second. Let those drops go into the back of the eye. And I've got a clean wipe here, and I'm just going to very, very gently wipe the eye down and out. Okay, so if there is anything, this will get it. Okay, so stay nice and still. Good. Okay. Is that feeling okay? Doing a good job. Good. How's that? Feeling a bit better? Right, I'm just going to take my magnifying glass now. And I'm just going to check that there's no actual damage on the surface of the eye. So we'll begin with the glass first, and then I'm going to use a torch as well just to magnify again, alright? So just stay nice and still. Just looking to see if I can see any damage that maybe, if there was some grit, it may have left like a cornea scratch. Okay, I don't see anything, but I'll just grab my torch just to double check before we begin the proper examination, okay? I know, it's not nice, is it, having the torch in your eye? You're doing a good job though. Blinding myself half to death. There you go. Okay. Yeah, see, I don't see anything. Would you like me to check the other eye just for, yeah, reassurance? Okay, that's fine. Let's have a look. Okay, yeah, I don't see anything there. Just let me know if you ever feel like this again. We can have a little bit of a check of your eyes, but otherwise I think it potentially could be this eye that's developing. Do you feel any better now? Okay, and do you feel like it's impairing your vision at all? No? Alright, that's great. So we can begin the examination. Okay, so I'll leave my torch out and we'll have a little look at your pupil dilation first, if that's alright. Okay, so stay nice and still. Good. 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 Great. Okay, and then the other eye here. Good. 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 Okay, I'm going to switch between the two eyes now, alright? Yep. Very good. This is just checking that your eyes can correctly adapt. Fab, okay. That's really great. Okay, I'm going to move on to the silent shot now, so if you could just direct your attention to it for me. Okay. I'm just going to use my pointer tool to point out the letters to you. Alright? Good. Good. Very good. Moving on. Good. How about this line? Do we think we could do this line? Yeah, give it a go. Good. Very good. How about this one? That's where it starts to get a bit blurry. Okay, we'll give it a shot. Good. How about this one? Nearly, and this one? Okay, we'll not cover each eye, so if you could cover this eye first. That's it, just like that. Okay? Good. Good. Okay. And this one. Very good. Moving on. Good. Great job. Okay. Next line. Are we okay? Good. Okay, and how about this line on this eye? Not at all. Okay, we'll switch eyes then. You can uncover this one and cover this eye this time. Alright. Ready to start back at the top. Good. Great. Next line. Very good. How about this one? All fine? Good. 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 Great. And last line. You think you can try with that eye? Good. Good. That's great. Do you think you could try this line with that eye? No, that's pushing it a bit far. Alright, my lovely, that's fine. Alright, let's move on. I'm going to now check your peripheral vision, okay? So, I'm going to be bringing my hands into your field of vision and I want you to simply tell me when you can see them, okay? I want you to keep your head nice and still for me. Could you stare at the Snellen shop behind me? Ready? Very good. Good. That's great. That's great. And now let's cover one eye and do the same again. Okay? Good. 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 Great. And switching. Very good. 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 Great job. Okay, I'm gonna test that peripheral vision again. I'm gonna be wiggling my fingers. I want you to tell me which side is wiggling, whether it's the left or the right. Okay? Good. Good. Very good. Okay. Last periphery test. I'm going to be holding up a few numbers and I simply want you to tell me what numbers you see. Okay? Again, focusing on the Snellen chart. No cheating. Alright? Okay. Good. Good. Very good. Okay, I'm going to ask if you could follow my finger with your eyes, keeping your head nice and still, just with your eyes, following my finger. Okay, covering one eye and doing the same again. Okay, switching eyes. great. You've got great ability to track. Okay. Lastly, I just want to test your depth perception. So I'm going to put my finger here. I want you to just stare at it. And then could you look at the wall behind me? And then look at my nose. Look at my finger. Back at my nose. At my finger. And at the wall behind me. Back at my nose. Back at the wall. Back at my finger. Back at the wall. And back at my finger. Good. Great. Okay, I don't see any issues with vision at all. I do think that yes, you do have a small prescription, but it is as simple as reading glasses. So I'm not going to try to make you purchase any, expensive prescription glasses. They are simply not necessary. You can purchase reading glasses at a flat prescription level, small prescriptions, even from pound shops. They're not very expensive. They're not going to be the most stylish of things, but I suggest that you go and grab yourself a pair of reading glasses if you're feeling like you need to. But we're talking 0.5 on prescription, which is so minimal. It doesn't seem worth it really, but we'll monitor it. Now that you've come back to us, we can set up appointments yearly to monitor your eyesight, and if at any time you experience that your eyesight's getting maybe worse, definitely pop in for an emergency appointment. We can get that checked out as soon as possible, and we'll go from there. Okay? Regarding your eyes, let me just go and grab my keyboard and we'll get you signed up for some drops. Okay? Give me 1 second. Okay, you got to plug these things in. Right. Let me just. Okay, do you have any entitlement to free prescriptions at all? Okay, that's fine. What I'll do is I'll send you an email over and you just have to send proof of entitlement, just so that we don't charge. But for now I can allow you to walk away with the drops for free pending that information, okay? And then once we've got it on file, you won't have to pay anything. There will be no fuss. Okay, right. That's all sorted, and if you'd like to follow me, we'll go and get the drops. Alright, this way. Hi, welcome. Come in, take a seat. How are you today? Okay. I believe you're my 4 o'clock appointment, is that correct? Wonderful. And you're here today for a full comprehensive examination. Today we'll be exploring the cranial nerves, but I'll also be giving you a full physical. I'll be checking your scalp as well as skin quality and texture. Is there anything else that was concerning you wanted me to check? Okay, so we'll just go as in depth as we possibly can today. We've got the time, alright. Let me take a little bit of information from you. We'll do a bit of a intake before we begin. This way I can figure out, based on the questions that I ask you, if there is anything in particular that I should be concerned about. Just grab pen. Alright, so if I could take your name first, just for my notes, and your date of birth. Okay, and could I just take a phone number so that I can contact you directly if I need to? Great. Okay, so if you could identify 3 main areas in which you could say were the reasons that you booked this appointment today. Okay, that's fine. So just to confirm with you, your concern regarding some hearing loss, scalp sensitivity, and a potential lump behind your ear. Okay, that's fine. So we can focus on those, but we will go through absolutely everything at the same time as you book the full health checkup. So regarding your lifestyle, if you could rate your general diet on a scale from 1 to 10, so 1 being fast food every day, little to no protein, vegetables and fruit, and then 10 being, really, really balanced, making sure that you're, eating your fibre and veg every day, having healthy whole grains, healthy fats, lots of protein, good varied diet. Okay, an 8's quite good. Alright. Okay, and then how about exercise? How would you rate your exercise throughout the week? Would you say that you're a very active person? On average, do you know how many steps you're getting a day? Do you wear a Fitbit, Apple Watch, exercise tracker of any sort? Okay. And how about exercise? What is the type of exercise that you prefer? How often do you take part? Okay. And how often do you play that? 3 days a week? Any other exercise? And how often is that as well? Okay, 3 days a week. Very active then. That's great to hear. How about your liquid consumption? Are you consuming a lot of water, more than 2 litres a day? Yeah. And how about alcohol? How many units would you say that you drink a week? You're teetotal, that's fine. Okay. Have you ever or are you currently a smoker? How about vaping? Do you undertake any activities that would be considered dangerous? Okay. Are you currently on any medication? Okay. And have you ever used or are currently using any illegal drugs? Okay, so could you tell me a little bit about when you first noticed this hearing loss? Okay, and was it sort of an all of a sudden you noticed a difference, or was it more of a gradual progression? Sudden change. Okay. Is it on both ears or just on one side? Your right ear. Right ear. Okay. And have you ever had ear cleanings before? No. Okay. Ever suffered with wax build-up? No. And have you ever experienced any hearing loss like this before? Okay. Was there anything that happened, occurred around that time that you can think of that may correlate? So, for example, if you attended a nightclub or a festival, for example, maybe you got some new headphones, maybe things like that. No? Okay. So you've not had any sort of sudden changes to diet, exercise? No sudden health changes other than these problems. That's fine. Okay. Moving on now to your scalp sensitivity. Whereabouts is it that you're feeling the sensitivity? All over your scalp. Okay. And if you could describe the sensation to me, what would it feel like to you? Right, okay. So like a tingling, fiery, hot sensation. Okay, that's fine. Yes, and regarding to the lump behind your ear, which, the right side again, okay? Right side, lump. I'll have a look in a moment, but when did that arrive? About the same time, okay? All right. And again, you haven't experienced any sort of head trauma? Nothing that you can recall, any falls or bangs to the head? No, okay. That's fine. Okay, so let's have a think about how I'm going to go about this. I am going to do the examination on you now. I'll perform the examination, but I do believe that we're probably going to get you to have that lump biopsied, just because of the correlation, same symptoms happening all at once and quite suddenly seems to draw up a little bit of concern. So we'll get you booked in for that as well. But I will make sure that we have a good look at it first, just to determine if there's anything wrong with it. Final questions before we begin. I do apologise. Regarding your scalp, was there any new products that you potentially started using? So any new hair brushes, shampoos, conditioners, hair oils? Have you had your hair dyed or hennaed recently? Right, okay. It does sound like a henna reaction, yes. Have you noticed any redness on your scalp? It does sound like a henna reaction, but of course, because you've had the other issues as well, we want to cancel everything out, make sure that nothing is untoward. So, let's begin. I'm just going to begin by simply examining your overall health. So we're going to take your vital signs first, okay? So I can start off having a listen to your chest. So if you could lift your top up. That's great, thank you. Okay, I'm going to come quite close to you here. I'm just going to listen to your lungs for a moment, okay? So if you could just breathe nice and normally for me. That's great, keep breathing nice and normally. Good, nice and relaxed. Okay, and now take a deep breath in. And out. Okay, good. Over this side, deep breath in. And out. Okay. I'm just going to reach around the back of you, alright? Stay nice and still. Okay. Just continue to breathe normally for a moment. Okay, and deep breath in. And out. Deep breath in. And out. Okay. I don't see any problems there. Pop this down. Okay, I'm next going to take your pulse using this oximeter. Could you just put this on your finger just like so? Okay. Just give it a minute. Okay, so your current heart rate sitting at 73, that's nice, and oxygen levels are currently at 98%. Very good. Okay. Let's take a few notes as I go along as well, just so that we can keep ourselves updated. So, lungs sounding nice and healthy. And 73 and 98% oxygen levels. Okay, that's great. Okay, and then next I'm going to take your temperature. So I just need to take this ear by ear, so just stay still. On the other side here. Okay, that's great. So it's in at 37.1. Okay. Lastly, for your vitals, I just want to take your blood pressure, okay? Alright. Okay, let me just strap this onto your arm here. Okay. Okay, there we go. Let's take this off here. Great. Okay. And it's nice and healthy as well. Okay, right. So we've tested your vitals and they all seem fine. So what I'm going to do next is I'm going to have a little look at your eyes, ears, sense of smell, have a look inside your mouth and have a look at your nerves, okay? So I'm going to do a little bit of a cranial nerve, okay? Now this is just to examine your overall general health, okay? So we're going to begin with the eyes. I've got a few different examinations I want to do with you today. I'm going to start off first and I'm going to be testing for your pupil dilation, okay? So what I'd like you to do is to focus on the wall behind me. I'm going to come nice and closely here, and I'm just going to gently flash the light into your eyes to check for your pupil dilating in and out, okay? Okay. Good. Okay. Good. Good. Okay, and the other eye here. Okay. Good. Good. Great job. I'm going to put my hands in between your eyes here and just flash from side to side, just like this. Good job, keep going. Okay, I'm just going to swing from eye to eye here. Good. Great job. Now I seem to have lost my occluder, so I'm just going to do this with my hands. I'm going to cover your eye one by one, and then uncover, cover, uncover. Okay? Okay. Good. Good. And on the other side. Good. Great job. Okay. And now switching between the two. Great job. Let me just make a couple of notes here. Okay. Next, I want you to draw your attention to the Snellen chart behind me, and I'm going to be asking you to read it from both eyes and then each eye at a time. Okay? Okay, so I'm going to point to each letter, and I want you to simply read aloud for me. Good. 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 Okay. Good. Can you keep going? Okay. Good. Can you keep going? Any more? And to try the next line. Good. Good. And let's start at the top again. Okay. Good. Good. Okay. Good. Mhm. Mhm. Good. Good. Keep going. Good. Mhm. Okay. Good. 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 Mhm. Very good. Can we keep going? You can't read this line. Okay, let's switch now and cover the left eye. Let's see if your right eye is any better. Okay. Good. Mhm. Good. Good. Yeah. Mhm. Good. Good. Mhm. Good. Good. Okay, can we read this line? Yes. Good. Good. Mhm. Good. Good. And how about this line here? Yes. Good. 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 How about this one? No? Okay, that's absolutely fine. Alright. Okay, let me just make a note of your results. So it seems as though your right eye is slightly stronger than the left. Mm-hmm. Okay, next I'm going to be examining your peripheral vision. There's a few different exercises that we do to examine this. So I'm firstly going to ask you to keep your head nice and still and keep your eyes on a focused spot, so whether that's on my nose or if that's a point on the wall behind me. Okay, I'm going to be bringing my hands in and I want you to simply tell me when they appear in your field of vision. Okay, so for example, I can't see my hands out here, but I can see them about here. Does that make sense? Wonderful. Okay, pick your point. Ready? Good, remember, nice and steady head there. Good. 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 Good, let's do that one more time. Very good. Good. Good job. Okay, let's cover your right eye here and let's do the same again. Good. 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 Great. And now covering the left eye instead. Good. 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 Good, well done. Next peripheral test, I'm going to be holding up a few different numbers and I want you to simply tell me what number you see. So again, head nice and still, keep a focus point wherever you'd like that to be. Okay, I'm going to step a little bit further back here. Ready? Good. Okay. Good. 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 Okay. let's do that again. Let's cover the right eye now. Ready? Good. Very good, okay. Covering the left eye now. Let's do that one more time. Ready? Good. 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 Very good. Okie dokie. Let me just make a few notes here now. Last peripheral test, similar to the one that we just performed. I want you to again keep your head nice and still, focusing on one point. I'm going to be wiggling either my left, your right, or my right, your left, and I want you to tell me which side is wiggling. Okay? Ready? Good. 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 Okay, covering one eye again. Let's do the same. Ready? Good. Good. Okay, and then covering the other eye now. One more time. Ready? Good. Good. Very good. Okay, that's the end of your periphery test. You passed with flying colours. I think overall your eye health is absolutely great. You seem to be able to read the chart to quite high standard. We don't tend to expect somebody of your age to be able to read the bottom lines anyway. So I'm happy there. So let's move on now to your sense of smell. I have these lovely little vials with me. Each one has a different scent, and I simply want you to tell me what you can smell. Okay? So we'll start off with this one. I'm going to waft it underneath your nose like so. What can you smell? Lemon, good. Okay. Next. What can you smell? Strawberry, very good. Okay. And what can you smell? Try again. What can you smell? Okay, like outdoorsy. It was pine. So, yes, I'll give you that one. Okay. Next. Okay, what can you smell? Cinnamon, very good. Okay. Last one here. What can you smell? Garlic, very good. Not such a pleasant one to be smelling. Alright. So the smell seems absolutely fine. I'm just going to have a quick little look into your nose if you don't mind. Let me just grab my torch. Okay, stay nice and still. Just going to have a look up here. Good. Okie dokie, that's absolutely fine. So, I'm going to move on to your ears now. We're going to do a little bit of a hearing test, but firstly I'd like to have a little look inside your ears if that's okay. Just keep my torch out and let's have a look in this ear first. Good. Okay, and the other ear here. Okay. Right, so both of your ears look nice and healthy. I'm going to do some hearing examinations on you now, okay? So, firstly, I have this tuning fork. I simply want you to close your eyes and tell me when you can no longer hear it. Okay, so close your eyes for me. Good. And again. Very good. Very good. Okay. Just write some notes here. So you can effectively hear it low frequency. That's great. Okay. And now I'm going to be fluttering my fingers in either one of your ears, keeping your eyes closed again. I want you to simply tell me whether it is in your right or your left ear. Okay? Good. Okay. Good. Good. Both, that was a trick. Well done. Okay, and now I'm going to be making the same sound again, but getting further and further away, and I want you to tell me when you can no longer hear the sound, okay? Keep those eyes closed for me. Good. And again. Good. One more time. Good. Okay. I'm now going to whisper some words from side to side, and I just simply want you to repeat the words back to me. Okay. Switch. Switch. Very good. Glass. Glass. Good. Spring. Spring. Good. Switch. Switch. Very good. Stipple. Stipple. Good. Umbrella. Umbrella. Okay. Click. Click. Good. Fabric. Fabric. Good. Book. Book. Very good. Okay. You can relax for a moment. I'm just going to make some more notes. Okay. So I'm happy with your hearing. It doesn't seem as though you've got any significant loss. I know that you're saying that you're suffering with hearing loss from this side. I don't see any sort of significant issue. There is no bacteria and no earwax build up at all. Your ear looks nice and healthy, there's no infection. I am going to examine around the ear for that lump as well, okay? But for now, I don't see any immediately hearing loss. But if it's something that you want to explore further, we can again book in for a hearing specialist to do an examination on you. We have a great audiology department. Okay, let me make a note of that. Okay, right, moving on. Lastly, I want to test your sense of taste before we move on to the muscle, okay? So, firstly, I just want to have a little look inside your mouth, if that's okay. Let me just see, I should have a tongue like that here. Here we are. My large group of toys and equipment. Okay, I'm going to pop this on your tongue. I'm just going to have a little look inside your mouth with my mirror and my torch, okay? So, if I could just ask you to hold that there for me. That's great. Okay, and then I'm just going to have a look inside here. Okay. When was the last time you went to the dentist? Okay, it looks as though you could potentially do with a plaque clearing, okay? You just got a little bit of build up, particularly on the back side of your upper teeth. But I don't see any immediate cavities. You may benefit from an x-ray, of course, but I don't see any immediate ones. Otherwise, the mouth looks nice and healthy. I don't see any infections, any white spots, any redness, any pus or oozing. Do you see you've got a sore throat at all? I know it's very common this time of year. No, you're all clear with that. Okay, that's fine. It looks nice and healthy. Okay, could you just do a few tongue exercises for me, please? So, I'm going to ask you to pull out your tongue. Good, and put it to the roof of your mouth. Good. Point it that way. That way. Can you roll your tongue? Great. Okay, give me 1 second. Okay, last taste test. I have 4 different vials with me. I'm going to use one of them to show you. They look just like this nice little glass bottle. Has a nice little pipette. So I have 4 of these. 1 salty, 1 sweet, 1 sour and 1 bitter. I'm going to randomly give these to you. Just drop 1 drop on your tongue and I want you to just identify to me which you can taste. Okay. Okay, open wide. Sweet, good. Okay, next one here. Sour. Very good. Okay. Bitter. Very good. sure that you can guess which the last one is. Well, do the test anyway, for continuity's sake. And just confirm to me that that tastes salty. Good. Okie dokie. Well done. Very happy with that. That's the end of your taste test. Okay. Okay, so moving on to your muscles now. We're going to be doing a few different tests again. I want to test sharp versus dull, your nerve sensitivity on your face and your arms as well. We're also going to test hot versus cold. Okay, so I'll get the sharp versus dull to begin with. Okay, so first we have sharp and dull. I'll let you know what these feel like. So here is sharp and here is dull. Okay, I'd like you to close your eyes and just simply tell me which you can feel. Okay. Sharp, good. Dull, good. Dull, good. Sharp, okay. Sharp. Dull. Sharp. Dull. Dull. Sharp. Very good. Okay. And then again with cold versus hot. So I have these two glass orbs with me here. Okay, this one is cold, this one is hot. If you like to close your eyes, so this is cold, this is hot. Okay, ready? Cold, good. Good, cold. Hot. Cold. Hot. Hot. Cold. Hot. Cold. Cold. Hot. Very good. Okay. So I'd like you now to again pull some funny faces for me. I'd like you to puff out your cheeks. Good. Okay, and then give me a big smile. Okay, frown for me. Okay, and try and squeeze your eyes shut and don't let me open them. Okay, that's great. I'm going to push on different points of your face. I want you to resist, okay? Good. Good. Very good. Okay, I'm just going to have a little feel of your face now. I just want to analyse your skin texture and facial symmetry here. relaxation. You can feel every touch. Okay, I'm going to touch you in a few different places. I want you to close your eyes and I want you to tell me where you can feel me touch, okay? Forehead, good. Good. Cheeks, good. Nose, good. Eyelids, good. Jaw, good. Lips, very good. Okay. That's great. Okay. Just want to do a few reflexes of the body and then we'll move on to analysing your scalp and the little lump, okay? You're doing really well. Thank you for being so patient with me. Okay, so hand strength next. I want you to grasp my hand as hard as you can. Very good. I'm going to pop my hands in between yours. I'm going to push out. I want you to push my hands in. Good. And let's switch. Try to push mine out. Good. Could you push against me? Good. And now pull me towards you. Good. Okay. I'm going to push your shoulders down. Try to push them up. Good. Okay. And lean forward. Good. Try and lean back. Okie dokie. Right. Let me just grab. Okay. I'm just going to tap this onto your knees now, just to check your reflexes, okay? Try and keep your legs nice and relaxed. Good, on the other side. Oh, that's great. Okay, right. Let's make a quick note and then I can move on and have a look at what you're worried about. As I said there, I don't have any issue with your hearing. But again, we can book an audiology appointment for you. Okay, let's have a little look at your scalp. If you could stay nice and still, I'm just going to get quite up close here now. So you're saying that it's all over, no particular spot now. Okay. I don't see any immediate sort of rashes or redness. Is it actually hot and painful to the touch? So it's got nothing to do with like the sensation, it just feels that way. Okay. Yes, okay, and you can feel everywhere I'm touching here, yeah? And they all feel equally as painful. Okay, no sore spots when I'm pressing now. Okay, alright my lovely, let's have a look behind this ear here, okay? Let me just have a look here. Right, I see. Okay. Oh my sweetheart. So that appears to be a lymph node. It does appear to be a little bit swollen. You said you're not feeling unwell at all. You haven't got a sore throat? No. Okay. Right. Okay. Okay. So let you know straight away that I'm not concerned about that lump. Can I just have a little feel of your neck? Just compare it to your other lymph nodes here. Okay. All of the other glands seem completely fine. Not raised, it just seems like this one behind the ear. It's a common one that's usually associated with sore throats, but you said that it's been up for a good few weeks and you haven't had any illnesses, colds during that time. Okay. Well, the best thing I can do for you then, personally, of course, I'm just a general practitioner. So from my own personal knowledge, I can't identify anything in particular that may be wrong at the moment based on what I've seen today. But what I'm going to do is I am going to refer you to the audiologist, but I'm also going to refer you to a specialist who specialises in glands, lymph nodes, the throat. Just have a thyroid checked as well, just because it's around that area of concern. You're not experiencing any soreness? No, it's just a little lump. Okay, that's fine. And then with your scalp sensitivity, I'm going to refer you to a dermatologist to check that out for you. Maybe take away a little skin sample so we can do some testing on that. They don't need to cut into, they can just flake off some of the scalp, okay? Nothing to worry about. And I am also going to refer you to have an allergy test, just so we can potentially eliminate anything that might be causing that reaction. Does that sound okay? I know it's been quite a lot for you, bless you, but overall I think you're taking care of yourself really well. I like to see the diet, exercise is really good, well done. We don't get many people saying that, they rate themselves an 8 out of 10 in terms of health. We more get off 5s and 6s, so you're doing really well. So what I'll do is I will put in a referral for you, and you'll be contacted by our reception with the bookings for those appointments. Those will be at the hospital, not at the GP surgery, okay? Alright, no problem. They should take about 2 or 3 weeks. But if anything gets more concerning during that time, if you feel, really unwell at any point, or if it's unbearable pain, or if you notice that lump gets any larger, for example, please immediately go to A&E. Please don't risk it. We love to see you there. If there's a genuine concern, we want to make sure that you're taken care of, okay? Alright, lovely. Well, it's been great having you here today. Please do let me know how you get on, okay? Alright, have a great rest of your day. Bye-bye now. Bye. Hello there, sweetie. Come on in, take a seat. How are you? Good. Are you from Mrs. Mackenzie's class? You are. Okie dokie, that's great. I just need to take your name for the register. Here you are. Just take your name off. Okie doke. Right, so my lovely, we're going to be doing some tests today, me and you, just to check that you're in tip-top shape and nice and healthy, okay? So I'm going to be looking at your eyes, your scalp, in your throat, checking your height. Is that okay? Okay, let me pop this back and we'll get started. Okay, so I'm going to pop some gloves on first, just so that we can stay nice and safe and clean. Okay. And my hands are nice and washed. Remember, it's really important to wash our hands. Every time that we've gone to the toilet, every time that we have eaten our meals, good. And any time that we've touched any surfaces before we put them back in our mouths. Yeah, so our hands, if they're going to go in our mouths, we need to wash them first. Okay, very good. I know you know your stuff. Right, lovely. I'm going to have a listen to your tummy first. So if you could just lift your shirt up just up to here. That's it. Okay, and just I'm going to listen to your tummy first. Okay, now listen to your chest here. Just breathe normal. Okay, and then could you take a nice deep breath in? Good, and out. Let's do that again. Deep breath in. And out. Good job, good job. Okay. That sounds great. Have you been poorly at all recently? No tummy problems, no sore throats, runny noses, sore heads? No. And when was the last time you went to see a doctor? Was it a long time ago, or was it just a little time ago? Okay, what did you go for? Oh, I see. And does that feel better now? Good, good job. Okay, I'm going to take your temperature. I'm going to pop this into your ear, alright? Good. Let's just check with the other one. That's great. I'm going to pop this on your finger, okay? Just like that. Good. Okay, you just give it a minute and it will say how fast your heart is beating. Okay, that's great. Well done. Alright, lovely. I want to have a look at your head first, if that's okay. Just to see that everything feels nice and healthy. Okay? Have you ever had nits before? You have. I used to get nits a lot when I was younger because I used to take my ponytails out of my hair. So I would be a lot more inviting for the nits. Okay, when was the last time you had nits? So it's been a while. And did mummy or daddy or whoever you're living with, did somebody put some treatment on your hair to get rid of them? And did they brush and brush and brush? Yes, good, okay. Do you feel itchy at all now? No? Okay, that's fine, my lovely. Okay, next I'm going to have a look at your eyes, okay? I'm going to use this bright light. I don't want you to look at the light, okay? So look over here instead. Okay? Good job. Stay nice and still. Be nice and quick for you. Okay. Good. Good. Okay, good job. keep going. Okay, I think we're nice there. Well done. Alright, okay. I'm next going to ask if you could follow my finger. So if you could keep your head nice and still and just using your eyes, follow my finger. Okay? Good. 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 Good job. Good job. Okay. Now I'm going to test to see how far you can see on the sides of your head. Okay. So I'm going to be wiggling my fingers like this, and I'm going to bring them closer and closer and closer to your head until you can see them. And I want you to just keep staring right at me. And I'm gonna bring them in, and I want you to tell me when you can see. Okay. Ready? Well done. Good. Good job. That's great. Well done. Okay, next I'm going to be wiggling my fingers, and I want you to tell me which side is wiggling, okay? So if you could point, lift your hand up to match my hand, okay? And keep staring at me as well. Good, look at my hands. Ready? Good. Very good. Good. Okay, and let's do that again, but this time I'm going to hold up some fingers, and I want you to tell me how many fingers I'm holding up, but keeping that head still and focusing on me as well. Alright, no cheating. Ready? Very good, 2, 4, good. 5, okay. 4, good. 3, good. 1, very good. Okay, last bit. I want you to read some numbers and some words for me. Okay, this is just a test how well you can see. Alright, so we'll start. What's this number here? Good. And what does this say? Monster, very good. Okay, how about this number? What's this number? 4, good. And what does this word say? Mice, very good. And how about this number? What's this number? Good. And could you read that word? Friends, very good. Okay, and how about this number? What's this number? Good. Can you read these words? Good. Good job. Okay, last one. What's this number? Good job. And what's this word? Cats. Very good. Okay. Next, I'm gonna show you some colours, and I want you to tell me what colours you see. Ready? First colour. Red. Good. Next one. What's this colour? Blue. Good. And who's this? Stitch. Good. What colour? Green. Very good. And last one. What colour? Purple. Very good. Okay. How are you with your reading? That's a good breathing level. Okay, I'm going to ask you, I'm going to hold the Gruffalo here, and I want you to read the words out for me. You take your time, follow along with my finger, ready? Good, next line. Good, keep going. Good. Good. Last line. Good job. There's absolutely nothing wrong with your eyesight, is there? But I bet you've heard that book before. It's a good book, isn't it? Okay, my lovely. Last thing we're going to be doing, I want to test your strength a little bit, okay? In fact, let me just take your height first, and then we'll do your strength. You just stand up nice and straight and tall, staying flat on your feet, no tippy toes, okay? You stay there. Good. Okay, getting very tall now. You're measuring at 42. Are you one of the tallest in your class? I bet you are. Very good. Okay. So we're going to be testing your strength. I have this little rubber toy with me, and I want you to hold one side. I'm going to hold the other, and I want you to pull as hard as you can. Ready? So we're going to do this hand first. Ready? Pull. Good, and now the other hand, pull. Good, and now with both hands, big pull. Very good. Okay, I'm going to ask you to squeeze both my hands as tight as you can. Tight. Very good, okay. And now push on my hands like this. Very good. Okay, I want you to lift your shoulders up as high as you can for me. I'm going to try and push them down. Don't let me push them. Good. Good. Okay, and now we're going to test your neck strength. So I want you to push against my hand, okay? Good. Very good, okay. And I'm going to test your reflexes. So I'm going to take this little tool and I'm going to tap it on your knees and on your wrists, okay? And it's going to make you go like that. It won't hurt at all. It's such a light tap, okay? So knee number 1. Good. And knee number 2. Okay. Wrist number 1. Good. And wrist number 2. Good job. Okay. We're nearly done, my lovely. You've done such a good job. Thank you for being such a good patient. I'm just going to ask you now if you could simply pull some faces for me. Alright, so could you puff out your cheeks nice and big? Just like that. Good, don't let me pop them. Good job. Okay, stick out your tongue as far as you can go. Good, and tongue this way like this. And the other way. Good job. Can you roll your tongue? Yeah. Good job. Okie dokie. Could you grin nice and big for me? Like this. Good. Just going to feel around your cheeks. Okie dokie. Could you pull a shocked face? Why did you go? Good. Stay there. Let me just have a feel in your throat. Stay there. Good. Okie dokie. Relax. Okay, I want you to frown for me. I'm going to try and push your eyebrows up. pull a sad face. Good. A big happy smile. Good job. Okay, keep that smile there. And I'm going to send you back to class with that big, beautiful smile. All right, my lovely. Thank you for being so good. I'll let Mrs. Mackenzie know just how good you've been today. All right, lovely. If you go back to class now, she should give you a sticker and a lollipop for being so good. Okay. All right. Bye-bye now. Bye-bye. Very nice to meet you. Thank you for joining me on such notice. I know that I only booked this appointment with you, I think yesterday, was it? Thank you for opening your time so quickly for me. So I believe that you're suffering with a rare case of tingle immunity, is that correct? I see. It can be quite a difficult thing to deal with, especially when you rely on ASMR and tingles for sleep. Yeah, your relaxation and well-being is so important. Okay, well, I'm just going to take some information from you first, and then we'll do a little bit of an assessment before we start with your treatment, okay? Alright. Okay, let's take a bit of info first so that I can contact you easily. Could I have your first and last name? Great, your date of birth. And a contact number for you. That's great. Okay, so when did this tingle immunity start? 3 weeks ago. Oh, you poor soul. Okay. And has it been like you've slowly noticed you've been less susceptible to tingles, or has it just been a complete, like, I don't get any tingles anymore from ASMR? Okay. That's really strange. So one day you just woke up and they just gone. No problem, okay. Can you recall maybe there being an incident or a video that you may have watched that maybe triggered a misophonia, meaning that you know, were irritated by sound as opposed to tingled by it? Okay, I can't think of anything that comes to mind. Sometimes it can be maybe our mood. Have you felt that you've been stressed at all in particular? Any anxieties, worries, work-related issues, family-related issues? Have you been getting yourself particularly upset by anything? Any losses, for example? Okay. Have you had any illnesses, been unwell at all? Any ear infections? Okay, that's some more. So let's just check your dilation first here. Good. 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 Okay, and the other eye. Good. 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 Great job. Okay. Just switching in between the two here. quite intense. When I mean intense, I don't mean fast and aggressive. I mean strong, tingle-inducing. These classic 10 styles of triggers that will hopefully restore that tingle immunity. Yes. Alright. Right, let's get you taken off this monitor here. Give you a little bit of a break for a second. And then switch to this finger. Follow this finger, don't get distracted. Very good. Now look at my nose. Look at this finger. Look back at my nose. Follow this finger. Back at my nose. Look at this finger. Very good. Okay, I'm happy with all that. Let me remove my gloves and we'll get on with the colour vision examination. Firstly, I'm going to be asking you to identify some primary colours and some strong standing colours, okay? So these are just simple answers, just the generalised colour. Okay, so what colour is this? Very good. And what about this? Black, very good. How about this one? Yellow, very good. This one? Red, good. How about this one? Good. And lastly, how about this colour? Blue, very good. Okay. We're now going to do something called the shower test. So this is a dots test, and there will be a number in the dots. I want you to tell me what number you can see. Okay, so first one. What number? What number can you see there? Good. 10. So there's the 1 there. And the 0 here. Very good. Okay. Next. What number can you see? 3, yeah. 3, yeah. 3. And what colour is this? Green. And these ones? Yeah, like a brownie pink. Good. Hello, thank you so much for coming in. Can I just catch your name again? Lovely to meet you. I believe you're the 12 o'clock. Well, it's lovely to meet you. Welcome to the ASMR medical trials. Thank you so much for agreeing to participate. My name is Dr. Sophie and I will be submitting you in for the trials today. So this session with myself is going to involve a health check. I need to examine you, if that's okay, if you give your consent. Thank you very much. And I'll be doing a relatively thorough examination with your overall vitals and your body receptiveness, so that we can have almost like a starter, something to compare to once you have taken the medicines that we will be trialling over the next 2 weeks. It's almost like our baseline, so then when we compare our results, we know what your body regularly responds as, and then we can see if there have been any changes. Okay, great. So I'll be doing that health check on you, and there's also a form that I need to go through with you today, if that's okay. It's just going to give you quite a lot of detailed information about the trial itself, what your rights are, who you need to speak to if you have any sort of concerns, and then we'll be going through a consent form as well. Okay, and at the end of this session, I'll just tell you where you need to go. You'll be in a private room. Sometimes we have private rooms, sometimes we have bunks as part of our medical trials, but some of the symptoms for this medical trial can be relatively distressing, so we put all of our participants in singular rooms so that you've got the privacy and space if you end up feeling any of these symptoms and would like a little bit of peace and quiet. Okay, again, we have to ask for your consent, so it's completely up to you. If anything feels concerning, worrying to you, and you would no longer want to participate, you're more than welcome to not sign the consent form and to leave whenever you feel comfortable. Okay. Great. So let us begin with the medical examination. We'll start off with your vital signs, if that's okay. I'm going to put some gloves on, just so I can keep you nice and safe from any germs that I might be carrying. Of course, you've got to understand that with doing medical trials, we come across a lot of different people. So, ergo, a lot of different sicknesses and illnesses, excuse me. So it's important to keep ourselves and other patients nice and safe. And of course, this is an examination as well to consider whether or not you are medically fit to take part in this medication trial. Okay, so firstly I need to ask you, are there any medications that you are currently on? Okay, that's absolutely fine. Paracetamol's not a problem. We can provide paracetamol to you at select times during the trials as well if you feel like you need. Okay, but there are some symptoms that we don't want to provide paracetamol for because we want to be able to see the symptoms fully present themselves. Alright, great. Any medication, and are there any current medical problems that you're having? Are you presenting any illnesses today? No? And how about in the last month? Just a bit of conjunctivitis. Okay, just give me a second. I'm just going to write this down on the front of the form. Okay, That way I know that you told me that. Okay, we'll come back to that in a minute. Okay, so if you're happy to go ahead, then I'll begin the examination. Okay, I just want to just have a quick look at your overall skin quality. Making sure that you don't have any signs of excessive skin dryness or excessive skin oiliness, any pustules or redness, scarring. Okay, I'll just stop. Okay, all seems fine. I'm just going to have a feel of your glands if that's okay. Any pain? No? Maybe down the neck. How about here? No? No? Okay. Let's have a nice little listen to your chest first. Listening to your heart and your lungs, so if you could just lift your top up, thank you. Listen to your heart first of all. Okay, no obvious signs of rhythm or irregularity, so if you could just breathe nicely and normally for me to begin with. Okay, and just take a deep breath in. Good. And out. Good. Okay, deep breath in for me. Okay, reaching around the back of you here. Okay, breathe it normally for me again. Good. Good, okay, and deep breath in. And out. Okay, and in. And out. One more time. Deep breath in. And out. Okay. Very good. That sounds all nice and healthy. Put these away. Okay. I want to take your blood pressure next, make sure that's nice and normal. You could just lift your sleeve. Okay, ready? Okay, that's all great. Just take that cuff off. Alright, great. Let's put that down. Okay, next I want to just take your temperature. If I could just pop this in your ear. Okay, let's just try the other ear. Okay, very good. 37.1. Nice and healthy. Just have a look. Okay. And if I could just take your heart rate, I'm just going to pop this on your finger, okay? just give it a second. Okay, we're currently sitting at 97. Are you a little bit nervous? A little bit? Bless you, that's absolutely nothing to worry about, okay? Your blood oxygen's nice and healthy at 97 as well, so that is great, okay. So vital signs seem to be in tip-top shape, well done. We will take your blood work as well. I think they're going to come tomorrow morning and do that for you, okay? That's just so that we can keep an eye on all your different levels. I want to do a few different response tests with you now as well. I want to check your overall strength, mobility and vision responsiveness. Okay, so I'm going to begin with the vision. I just want you to keep your head nice and still and follow my finger. Good. Very good. Okay, and next I'm going to bring my hands into your peripheral vision. I just want you to tell me when you can see them. Okay? Good. 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 Okay, let's do that one more time. Good. 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 Great job, well done. Okay, now we're going to do a little bit of strength responsiveness. So I'm going to ask you to try and lift your shoulders and I'm going to push them down. Just don't let me push them down. Okay, good. I'm going to ask you to push against my hand. Good, and the other hand. Good. I'm going to try and put your head down. Try to lift it up. Good, and again I'm trying to lift your head up. Don't push your chin against me. Good, okay. Push against my hands. Good, and grip my hands as hard as you can. Good. Okay, lastly, I just want to do a little skin sensitivity test on you, just to make sure that your facial nerves are working nicely, that you're feeling everything. So, okay, I have two different objects. I'm going to ask you to close your eyes in a moment. One is sharp, so this is a pen. This is how it feels. Okay, so that would be sharp. And then we have a little cotton ball, so this would be dull. Okay, so sharp or dull. I want you to close your eyes and just tell me if you feel sharp or dull. Ready? Okay, close those eyes for me. Dull, very good. Sharp, good. Sharp, okay. Good. 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 Very good. 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 Okay. Great, I don't see any problems there. Alright, my love, that's all of the physical examinations. I'm now going to run through the test form with you. and some of the info, and then I will give you the medication. All right. Okie dokie. So just have a look at what some of the information I want to read to you. Some of it I will give to you and you can read in your own time, but I just want to sort of generalised. So the reason that you have specifically been invited to take part in this medical trial is because you have self-identified as a healthy individual through the medical examination I have done today. I can confirm that, so I can sign there. Okay, so I need to state to you that there are 200 participants taking part in the next 2 weeks, and all of them are volunteers as well who have identified themselves as healthy individuals. Do you have to take part? The answer is no. It should be clear that taking part is entirely voluntary, so you can leave at any time, and withdrawal will not affect clinical care, so you are still a patient if you decide to withdraw from the trial, but obviously if there's any sort of medical concerns that you have, you are still our patient. We will make sure that you receive all the medical attention that you need. Okay, let me just... Okay, what happens if I do decide to take part? So this is almost like a bit of a hotel, I suppose. It's free accommodation, free food and free entertainment for the next 2 weeks. We have loads of different films on, televisions, and you have access to iPads and the internet. We provide you with 3 meals, 2 snacks a day, but you know, the kitchen's open if you ever want just a slice of toast or whatever. You're more than welcome to help yourself. The only thing that we ask of you is that you make yourself available every 4 hours for monitoring. So we'll come round, ask you how you're feeling. We will do your blood pressure and take your heart rate and do your temperature. Okay, that's all we ask of you. Okay, right. Don't need to worry about that as I'm not collecting samples. Again, we're only just collecting blood, but that is not for the actual medication itself. That is just for our monitoring. So you can actually decline that if you want to. I must let you know that if we are going to take the blood sample, if you're okay with that, and that there is the possibility of bruising or fainting. Okay. Okay. So, side effects. So side effects come in different levels of frequencies. So we would say, for example, there is a 1 in 10 chance of said side effect, or there is a 1 in 100,000, or in a 1 in 1,000, or even more. So very common side effects are 1 in 10 participants. Common would be 1 in 100, or uncommon would be more than 1 in 1,000. So that would be considered sort of an uncommon rare sort of situation. So side effects for this medication, we have very common side effects which tend to be headaches, dizziness and fatigue. Common side effects, but not very common, so sort of 1 in 100-ish. You can experience some vomiting and diarrhea, but of course that's why we've provided these singular rooms, because that can be quite a sensitive medical issue. I do have to let you know that there has been the rare side effect of anaphylaxis. That's what we are researching within these medical trials, is whether there is a consistent problem with this medication in reoccurring anaphylactic shock to those who have allergies. Okay, so if there's like a consistent allergen in this medication that we need to be concerned about, to where we couldn't prescribe it to certain individuals who have those particular allergens. You don't have any known allergen information, do you? No? Okay, but of course, because we are concerned about the anaphylaxis, we have, you know, medical monitoring the entire time. In your rooms will be a button, and you will also carry a button, medical alert button, with you at all times. There will always be nurses wandering around the space, so you know there'll be someone there to take notes, and we have EpiPens and obviously all of the medical professionals, so you are well taken care of. Of course, if this has concerned you, you're more than welcome to leave now, not take part. Okay, alright. Your GPs should be notified if you have your GP will be notified if you are participating in this medical trial, as it could affect the clinical care of you later on in life. So do we have your permission to contact your GP? If not, you can't take part. Okay. And we will keep note with your GP as well if there are any medical findings or medication findings later on, so that you can be informed. All of this information is confidential, so any of your personal information will not be given or recorded during this time. As soon as we have found our study data, your personal information is destroyed and will not be part of the medical study. Okay. Yes, okay, so you will also be compensated for your time as well. Part of the trial, you will be compensated any work-related fees. You just have to fill out the form for that, so you basically just have to declare your usual income, and that will be reimbursed for you, as well as any travel or childcare expenses that you may need because of taking part. Alright. Okie dokie. Yeah, that's fine. Yeah, I've talked about data. So with data, the only thing that we will be using is your assigned sex and your age. That will be the only things that are used as part of the data. So things like location, personal name, date of birth, things like that, those won't be specifically entered within the data. And I think we've covered everything. Yes, of course, as I say, you will have a medical alert button with you at all times. If you do have a problem, please, even if you feel like it's only a very mild symptom, please let us know so that we can put it on record as soon as possible, so then we can increase the monitoring for yourself. Okay, so even the common symptoms, so the headaches and stuff, if you do develop a headache, please let us know as soon as possible, because that could be an indication of a more serious symptom side effect developing in the future. Okay, so finally onto the consent form. Let me just add your participant identification number. Okay, so I confirm that I have read the information sheet dated, so as I read to you, and I have had the opportunity to consider the information, ask questions, and have answered these satisfactorily. Yep. I understand that my participation is voluntary and that I'm free to withdraw at any time without giving any reason, without my medical care or legal rights being affected. Okay. I understand that relevant sections of my medical notes and data collected during the study may be looked at by individuals. Where it is relevant to taking part in this research, I give permission for these individuals to have access to this medical record. Good. If appropriate, I agree to provide a sample as part of my involvement in this study, and I understand I will not gain any direct personal or financial benefit from them. So, for example, your blood, we're only taking it as a sample. You will not be reimbursed for the blood that you're giving. Okay. We won't be taking any audio or video, so that one's irrelevant. I agree to my general practitioner being informed of my participation of the study. We went through that one. I understand that the information held and maintained by the NHS and other central UK NHS bodies may be used to help contact me or provide information about your health status. Yeah? So we can contact you at a further date if there is something that we find worrying. I understand and agree that my samples and your symptom responses will be used in research aimed at understanding the side effects of this medication, and that results of these investigations are unlikely to have implications for me personally. Okay. I understand that this research is not used for my own medical diagnosis, and that these symptoms that I have are not routinely looked at by a doctor. If a concern is raised about a possible abnormality, I will be only informed if a doctor thinks it's medically important, such as the finding has clear implications for the future of my current health. Okay? Yeah, we're all good. We're not using those. Okay, just write your name. The date today is the 23rd. Okay, and if you could just sign there for me. Thank you. Okay, and I just need to sign for my consent. 23rd. Okay, wonderful. So if you're happy to go ahead, then I am now going to escort you over to your private room. I'll show you a little bit around the facilities. I think lunch has just started, so once I've showed you around, I'll try and be quick. You can go and grab lunch, okay? Alright, thank you so much for being patient with me. And if you'd like to follow me, okay, this way. Hi, come on in. That's it, take a seat. Make yourself nice and comfortable. My name is Sophie and I'm going to be acting as your optometrist today. I believe that we've met before, haven't we? That was quite a while ago. So, are you here for your annual eye checkup today? Wonderful. Well, the eye exam is going to be relatively extensive. I'm going to be performing a few different tests with you today to check various points of your eyes, and I'll also send you through to my colleague so that she can take some photos of the back of your eye as well. Okay. She will perform the glaucoma test as well if you are over the age of 25. Okay, you just let her know when you go in there. Great. Okay, so firstly, is there anything that has changed since your last appointment? Anything that you may feel like you're a little bit concerned about? Okay, and I believe that you wear glasses, is that right? Okay, did you get a new pair last appointment? Okay, so how long has it been since you've had your last pair of glasses? Okay, so we'll definitely have a checkup of your eye, see if your prescription's changed, seeing as that has been quite a while now. So it's probably likely that today you're going to be needing some new glasses, a new prescription. But luckily for you, we are offering today 25% off any purchases of glasses. So if you'd like, you can come in later, as long as it's by the end of the day, to book your glasses appointment, and then you can have new ones sent off for you and you get that offer. Sound good? Alright, my lovely. Well, let's get started on with your eye examination. We're going to begin here with the Snellen chart behind me. Okay? Alright, my lovely. So using my pen, I'm just going to point at the different letters, and if you could start first with both your eyes and just tell me what letter you read, okay? Good. Okay. Good. 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 Great, keep going. Good. Okay. Okay. Good. Okay. Do we think we can try this line here? Yeah, give it a try. Okay. Okay, so we're struggling a little bit with that line there. So if we could cover this eye now first, and we'll do the same again starting from the top, okay? I want to see how far down you can get with each eye. Okay. Good. Keep going. Okay. Good. Good. Try that one again. Okay. And again, try that one. Okay. Okay. Let's uncover that eye now and try to cover this eye this time. And we'll just do the same again. Okay. Good. Good. Yeah. Good. Good. Keep going, you're doing really well. Good. Yeah. Okay. Nearly there. Keep going. Good job. Okay. Okay. Can we try this last line with this eye? Just give it a go. Okay. Okay. Try this one again. Okay. Alright, so So it seems as though that we're having a little bit more trouble with your right eye as opposed to your left. Was that sort of similar to the last appointment? Yeah. Alright, just give me 2 seconds. I'm just going to make a note for myself so that I remember. Okay. Okay. Great, you did a really good job. Next, I'm going to be having a little look at your pupil dilation. Okay, so I have 2 different lights with me here. We're going to be using both. One is a UV style purple light, and with this I'm going to first check that there is no damage that I can see to the eye. Okay, so we're looking for anything that shouldn't be in there, so any sort of sand, grit, or dirt, and then again if there are any abrasions to the eye itself. Okay, but your eyes feel fine overall? Good. Okay, just stay nice and still. I'm going to have a little look at this eye first. And as you say, you don't feel any sort of pain or discomfort, anything like that? No? That's good to hear. Usually if there's something in the eye, we tend to get quite noticeable irritation. Okay, moving on to the other eye here. Again, no issues with this eye now. Okay, looks lovely and healthy. What I'll now do is have a little look at the outer eye as well, just surrounding areas to make sure it's nice and symmetrical, feeling nice, there's no lumps or bumps that we should be concerned about, okay? So I'm just going to prep. Using an anti-bac wipe first, just to keep my hands nice and clean. Obviously the eye is a very sensitive area, we don't want to be adding unnecessary infections, okay? You doing okay? Good. It is. It's very, very warm, isn't it? I feel very, very lucky to be seeing the back of the heat wave now. Fingers crossed. And I'm going to pop some gloves on as well, okay? Just for that extra layer of protection for you. Okay, there we go. So just stay nice and still. I'm just going to very, very gently have a feel around the eye. Will you just let me know if anything hurts, okay? Okay, good. Put these gloves to the side. Alright, so I'm happy with the quality of your eyes. I'm happy with the condition. There seems to be nothing to worry about at all. And you're, again, as you said, not experiencing any pain, so we're all set. Good. Okay, so I'm going to take my next torch here now. This is a nice bright light, and I'm going to be looking in your eyes again, but this time I'm going to be assessing your pupil dilation. Okay, so we'll start off eye by eye, and then I'm going to be switching from eye to eye to check that you're dilating and contracting as the light switches. Okay, I want to make sure that that dilation is nice and even. So, I'm going to start off with this eye here. Let me know if at any time you need a break, okay? Mm-hmm. Good. Mm-hmm. Good, okay. Moving on to the next eye here. Okay. Good. Good. Okay. Mm-hmm. Okay. There seems to be a little bit of laziness on this eye when it comes to pupil dilation. So as I said, I'm just going to compare the two now, okay? Okay. Good. Good. Keep going. Great job. Mm-hmm. Okay. Alright, my lovely, I'll give your eyes a little bit of a rest now, okay? Okay? Better? That's the last of the light examinations I'm going to be performing for you today. We're now going to be doing some periphery testing. So I'm going to be testing your peripheral vision, meaning the space that you can see out of your immediate eye line, so all around this area here. Alright, so we're going to do a few different tests to examine this. I'm first going to ask you to keep your head nice and still for me and just focus in on my nose. Okay, I'm going to be bringing my hands into your field of vision, and I simply just want you to tell me when you can see. Okay, ready? Good. 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 Okay, let's do that again. Good job. Good. Good. Okay, let's cover this eye and we'll do the same again, keeping your attention on my nose, keeping that head nice and straight. Good. 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 Good, okay. And switching over now. Okay, same again. You're doing really well. Good. Good. Great job. Okay. Next periphery test, I'm going to ask you again to keep your head nice and still and focusing on my nose here. Alright. And I'm going to be putting up a few different numbers. And I just want you to tell me what number you can see without looking at it. Okay? I'll do that with both eyes now. Alright. 5, good. 2, okay. Good. 3, good. 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 Great job. Okay, we're going to do the same, but now eye by eye. So covering your right eye first. Ready? Good. 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 Okay. Alright, and then covering your left eye this time. The same again. Ready? Good. Okay. Good. 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 Okay. Good. Well done. Very good. Okay, last periphery test. We're going to be doing exactly the same, but this time I'm going to be wiggling either my left, your right, or my right, your left fingers, and I just want you to tell me which side is wiggling, but again keeping your focus on my nose. So let's do your right and your left. Ready? Okay. Good. Good. Okay. Good. Great. Okay, and then again, let's cover one eye to start with, and we'll do exactly the same again. Okay. Good. Maybe a little back. Good. Okay. Good job. Good. Good job. Okay, and then uncovering and covering the final line. Alright, let's do that again. Good. Okay. Good. Okay. Good job. Alright, my lovely rest. Okay. That's the end of the periphery examinations. Your peripheral vision seems really nice and healthy. You seem to be able to see the full parameter nice and clearly. Okay. Finally, we're just going to be doing some eye tracking, especially as we saw a little bit of laziness within the pupil dilation for this eye. I want to make sure that the pupil tracking is following exactly the same, so that it's not an actual sort of laziness, it's just maybe the dilation's a little bit different. Okay, so I'm going to be asking you to simply follow my finger with your eyes. So again, keeping that head nice and still, this time just moving your eyes around the room. Okay, ready? Good job. Good. Okay, great. Now let's test your depth perception. Okay, so I'm going to be asking you to stare at my finger. Good. And then stare at my nose. And then at the lamp behind me. Good, okay. Let's do that again. At my finger. And then at my nose. And then at the lamp behind me. Back to my finger. Back to the lamp. Then at my nose. Back to the lamp again. At my finger. Back at my nose. Back at my finger. Back at the lamp. Back at my finger. Great job. Okay, I'm happy with your eye assessment. Let me just write a couple of notes down here. Okie dokie. So, I think that your pupil dilation on this eye may just be due to maybe some tiredness. Do you stare at screens quite a lot? That can sometimes have an effect, definitely on our light travelling into the eye. We can be a little bit desensitized to it. Okay, so that might be what's occurring right now. But it seems as though, based on your Snellen chart readings, you are in need of a new pair of glasses. Okay, so what I'm going to do is I'm going to be doing a lens test with you now, just to assess exactly what prescription that you may need. Okay, so we're going to revert back to the Snellen chart, and I'm going to be using my lenses here. Okay, they come in a nice little fancy case. Okay, so you can see all of my lovely lenses here. I'm going to be using these lenses to assess what your prescription needs to be. And I'm going to be asking you whether a lens makes the image clearer or not. Okay. Okay, and we're going to be starting at your previous prescription. So I'm going to be placing the lenses in front of you like this, and I'm going to ask you whether they're clearer or not as clear. So we're going to be doing 1 or 2. Now you started on a 1.5, that was your most recent prescription. So I'm going to ask you if this is clearer. This is 1.5. So is this 1 or 2? Which do you prefer? 1 or 2? 2? Okay. And 2 or 3? 2 or 3? 2. Okay, so we've got the left eye on a 1.75 prescription. Let me write that down. Okay, starting the left eye now, we're going to continue on. We're going to go back to our 1.5. So we've got 1 or 2. Which do you prefer? 1 or 2? 2? Okay. 2 or 3? Again, 2 or 3? 3? Okay. 3? 3 or 4? 3 or 4? 4? Okay. 4 or 5? 4 or 5? 5? 5 or 6? 5 or 6? Again, okay. We've got 5 or 6? 5. Okay. Okie dokie, so left eye sitting at a -2.5. So we've had a 0.25 progression on the right eye and a -1 progression on the left eye. Okay. Alright, so I've written down your prescription, and what I can do for you now is send you over to book a glasses appointment. Yes? Great. You'd still need to go in for your photograph and your glaucoma testing. So I'll send you off to do that now, and then we'll get you booked in for your glasses appointment. She should be available today. It has been quite busy, but there are still a few slots left, I think. Yeah, so you can get that 25% discount. Alright, great. Do you have any questions for me at all? No? Alright then, my lovely, I will leave you to it. Best of luck with your glasses appointments. I hope that you find a new pair that you like. Alright, it's been a pleasure. Okay, bye-bye. How was your eye appointment? Good. I believe that you were just with Sophie, right? Okay. Alright, and it went well, yeah. Yes, you do get the 25% discount if you booked think some of them have a premium price option. For them we have some more sort of textured plastic hard cases, and if not, our cases as a standard are these fabric-heating felt pouch cases instead. I know they're nothing special, but they do the job. They're especially good if you need something quite thin to sort of fit into maybe a coat pocket, or maybe you've got a very small bag that you need to put the glasses into. Only thing is, these cases do collect a lot of fluff. So if you've got any sort of pets or anything, you've got any dander in the bottom of your coat pocket, this is going to pick it up definitely. But again, feel lovely and lightweight, right? So anyway, I will show you our next most popular frame. Now this one is a little bit more like maybe the one that you've gotten already. They need a good clean. Whoever did the last glasses consultation did not clean the glasses nicely. They've got various smudges on them. I do think I've got some lens wipes somewhere. They may be a little bit more helpful. This is maybe not getting all the smudges off. That's probably the best I can do on that one. Let's move to the other one. You can, yes. You can get like a lens spray as well that helps when cleaning them with cloth. Right. Okay, I think that's probably the best we're going to do. Okay, so this pair, again, almost has that tortoiseshell pattern, but you can see this is a hard plastic frame. This has the almost cat-eye shape as well, but it's a lot more square and a lot thicker. The actual lens itself, let me just grab the other ones you can see. In fact, anything, it's actually the same size lens, but the frame definitely makes it look a lot bolder and thicker on the base. So we'd call these a medium frame. These are called Barbara Brown. You can see they have a few different colours of brown in them. And then it's exactly the same on the arm as well. We don't have any nice rubber ear protectors. These are just the plastic frame, but these are cheaper because they are a plastic frame. Would you like to try them on? Yeah. Okay. There we go. I do think those suit you really nicely. If you have a look. Well, I think that you wear your makeup quite naturally, so it helps them to sort of bring attention to your face, but in a soft way. I think if you were to have quite a bold lip, it wouldn't look quite right. Yeah, well, I can show you, definitely. I think with a bolder lip, they may be a little bit too much, maybe look a little bit sort of matronly and dated, like a little bit sort of librarian. I think it helps as well. You've got much lighter hair. texture too. I believe that the hard case would be £35 extra, but your 25% off offer would work with the £35. So, what is that? £17.50 is 50%. So, £9, £8.50, £8.75 off of those, which leaves you at £21. No idea. No idea. I think it's like 26. I think it's 26.50. Something like that. Anyway, you get about £8 off with the 25% off. These, obviously the cases are much chunkier, so not so practical as opposed to this, where obviously fitting it in a pocket, for example, or a slimline bag, but it does give you the convenience and the sort of peace of mind knowing that the glasses are nice and safely contained. And I just overall quite enjoy the texture of them. So here are these glasses. We have our own little cloth to clean them. These are a little dusty. These glasses are also sort of a higher quality to the previous two that we've looked at. These, I think, are designer. We have, yes, Hackett. So a little bit more of the less affordable range, but they are very, very nice still. These now remind me a little bit of Clark Kent type glasses. You can see they have the rectangular square sort of frame. They're in that dark tortoise shell again, but these ones are black on the very front with the tortoise shell sort of underneath and at the back of the frame. We also have on the sides a metal detailing that has like a texture. Can you see that? With the little brand emblem on it as well. Gorgeous. So as I say, these ones are a little bit more expensive. Definitely an acquired taste, I think. The heavy rectangular frame, but you're more than welcome to try. Of course. There you go. How do they feel? to show you. Also in these cases, again, is that square frame, but this time it is the full tortoise shell. Let me just give them a bit of a clean up here. Okay, so here we go again. That's sort of that Clark Kent shape, but you can see it's got more of a tortoiseshell pattern to it. Particularly, you can see that on the back. Right, and it's just all the way through. This one does not have the textured metal, it instead has a larger emblem in a silver plating. So would you like to try them on? You're not interested in that shape? No problem. That's okay. Okay, let me pop them away for you then. So, out of the casings, would you be interested in a premium case? Yes. Okay. Let me pop these aside and I'll make a note of that for you. So we'll be going for the premium casing, of course that's with the 25% offer. And out of those two pairs of glasses, are you interested in either of those? Yeah, you really like the second pair. I agree, I think that this pair is definitely the one that suited you the best. I think the tortoiseshell pattern is something that, you know, really looks beautiful on you, but you definitely benefit from the wider eye and the sort of cat eye shape. Definitely, and these are beautifully lightweight glasses as well. Okay, is there anything bespoke that you would like on them? Maybe we